It's important for all of us to know how we take care of our mental health because mental health is not just about people who have mental illnesses, because we all have brains that we should be taking care of. We all know about nutrition. Nutrition, yes, is good for our body, but it's also very imperative for our brains. I know it's hard to have perfect nutrition all the time. However, we can just try our absolute best. Water is imperative for optimal brain health. How much water should we be drinking? Well, there's a great debate around that. However, I always say 8 cups or more, just as long as we're hydrated. And I track it on my phone, so I remember how much water I'm having in a day. Sleep is very important when it comes to mental health. It's not just about the amount of sleep that we're having, but it's about quality sleep. So for instance, somebody like me can have 7 hours to 8 hours. I prefer even 8.5. But for somebody in grade 7 to 12, they should be having 8.5 to 9.25 hours a night. But it's really important when we're waking up and when we're going to bed to ensure that we're getting quality sleep. Our circadian rhythm loves routine. So when we're doing the same thing every day, going to bed around the same time and getting up around the same time with the right amount of hours, our brains feel amazing. Calming activities are really important, whether we're walking our dog or reading or journaling, taking a bath, and doing all of these things for self-care are just activities that are calming. We are always in school or we're working, we're really busy. However, I always say take half an hour a day for a calming activity for something that you really enjoy. Exercise is imperative for brain health. When you exercise, your brain loves it, as does your body. Try a bunch of different activities and focus in on that one or those 2 things that you really enjoy so that you're getting in the physical activity that you need. Medication. It's a conversation between a patient and a doctor. However, I have been on medication for a really long time and I used to be totally ashamed about it. And then my father had a heart attack and I realized he was taking medication for his heart condition. He was not ashamed and I thought, okay, why am I? I don't feel shame in taking my medication anymore because I realize that I'm just doing what I need to do to take care of myself, and it's important that others don't judge other people for doing what they need to do to stay well. I hope that you will do a lot more exploring and research on ways that you can take care of yourself.